Hello, everyone, and welcome to RestartED's virtual town hall. This is the second in a series of panel discussions with educators devoted to rethinking, reimagining, and restarting our schools. My name is Greg Tafaro, reporter with USA Today Network, New Jersey, and I'm honored to moderate tonight's discussion. Those of you returning for a second straight week, welcome back. And those of you here for the first time, thanks so very much for joining us. RestartED is a dedicated group of educators. Their focus is on reopening schools amid the coronavirus pandemic and modernizing education through dialogue and action. Their goal is to improve the collective capacity of educators to serve students, staff, and communities. Tonight's all-star lineup of experts in alphabetical order includes Alicia DiLorenzo, Interim Deputy Director of Garden State Equality, mental health clinician, and founder of Living Yes. Chi Kim, CEO of Pure Edge, Pahara Aspen Fellow, and a former California Superintendent of Schools. Ken McGill, licensed marriage and family therapist and senior training consultation specialist in the Behavioral Research Training Institute with Rutgers University Behavioral Healthcare. Nellie Perez, Assistant Superintendent of Matawan Aberdeen Regional School District. She is a licensed social worker and was the 2019 New Jersey Special Education Administrator of the Year. And Mike Salvatore, Superintendent of Long Branch Public Schools and the 2019 New Jersey Superintendent of the Year. Thank you all so very much for being here. Joining us in cyberspace from the chat room and on social media via Twitter are Dr. David Adderhold, President of the Garden State Coalition of Schools and Superintendent of the West Windsor Plainsboro Regional School District. Dr. Jay Micah, Superintendent of the Matawan Aberdeen Regional School District. Dr. Scott Rocco, President of the New Jersey Association of School Administrators and Superintendent of the Hamilton Township School District. And Dr. Charles Sampson, Superintendent of the Freehold Regional High School District and President of the Monmouth County Superintendent's Roundtable. They'll be monitoring your questions and feedback in real time. Gentlemen, thank you for joining us as well. Throughout this town hall, the panel welcomes your questions and encourages you to share ideas as we create a collaborative atmosphere designed to strengthen education. The focus of tonight's panel discussion is social and emotional learning, wellness, and mental health. The following excerpt from an essay Ken McGill recently authored for RestartED nicely frames tonight's topic. Quote, school closings in New Jersey impacted 1.4 million students and 115,000 educators. Overnight, their lives and routines were dramatically altered. Instead of daily in-person interaction with their teachers and peers, students were forced into a new virtual world. Many witnessed the adults in their lives overwhelmed, frightened, stressed, and unemployed. Children's traditional physical and social outlets were suddenly taken away, with their world reduced to the size of their home. Many also lost people they know to COVID-19. The trauma to children has been massive, and the tremendous operational workload required of schools to simply reach the end of this academic year has made addressing social and emotional needs of students exceedingly difficult, end quote. With the proper context and perspective having been provided, let's get this week's conversation underway, starting with some questions for our panelists. And I'd like to start with you. How can the impact of trauma on students be assessed?
In terms of, I think the best way that we can do, and thank you very much for inviting me. I'm really being in a group of esteemed colleagues. It's been a true honor. I think the best thing we can do is listen. This is like no other trauma that we've ever experienced. This is not going to impact just the individual child. It's not going to impact just that individual family or school, even the community. It's the larger state, every system, and every component of our entire society and world. I think the best thing we can do from this point, the starting point, is to just listen and actively listen to those children and everyone around us. That's the best thing I could say in starting this conversation.
Would anybody else like to weigh in?
Yeah,
Mike,
you know, I think I think in addition to listening, you know, Ken brings up a great point. We're not that great at really deep listening, and it's really vital to this moment. But on top of that, following up with real intentional action beyond that. So we listen, we hear, we hold space for our youth, for our educators, for our school leaders, for our families. But then what action are we going to take beyond that? And really creating intentional action that aligns with what each individual needs, not a blanket, here everyone gets a piece of the pie. We have to be really intentional about the interventions that follow the listening.
Mike, after months of trepidation over reentry, how can an empathetic return be created?
Thanks, Greg. Greg, I love your energy too, by the way. I don't know if anybody's put that in the chat, but the way you introduced everybody, so excited and really depressing topic. But I want to keep that energy going because there's a lot of solutions to be discussed tonight. And I guess I want to build on exactly what Ken talked about, what Alicia was referring to in terms of not being a good listener. I mean, I think first and foremost, before we're going to talk about an empathetic return in SEL, we cannot ignore what's happening in society right now in terms of injustice, race, inequality. We've got to make sure we address that, because SEL is equity work, and equity work is SEL, and we just can't forget that. In terms of how do we begin a conversation, and you start courageously. There's books and literature around courageous conversations. That's where we must begin. And we've just got to acknowledge the fact that there's no such thing as a universal human experience. You know, everybody's emotions are relative and unique, and we've got to respect their perspective. I think the challenging thing right now is for an empathetic return to really come back and really think of where everybody is in that place and time, aside from listening and understanding. I think we have to realize that everybody wants to get back to normal, yet that's also their fear right now. Their fear is to go back to normal because they're not sure what new normal means. I think from a psychological perspective, we know that there's just a lot of fear generated on that one island of misinformation or lack of information, right? And that's what tonight's about. I think it's just to build some comfort around some more information, some strategies. I think we've got to just realize right now people are suffering. There's an old saying, it says, hurt people hurt people. Mm-hmm. Mm-hmm. And I think we've got to realize, you know, to begin a healing process, we've got to realize that people are hurt. And it's so important because if hurt people hurt other people, the stakes are too high. If our adults are hurt right now, we've got to make sure we're healing them before they ever encounter any children. Yeah. If we wait for that, our typical September stage, we give people 2 days of healing and then say, okay, good luck to it all. We're making a grave mistake. We've got to realize that if we want to heal people, we've got to give them the process to do that. I recently read in a poll, a national poll by KFF, they said 45% of the adults in the US right now say they have been negatively impacted due to worry and stress over COVID. That's almost half of America. And then there's broader research that talks about when we're isolated and lonely, what that does to our mental health. I mean, these are things that we have to consider. So we've got to start this healing process for our adults as soon as we can. And I don't want to hog too much time here, but I just want to give a couple suggestions that I think I've been really thinking about these things a lot, and I'd love to hear the panel's perception on ideas. So one of them is everybody's familiar with professional learning communities because everybody does it all the time. But this idea that you kind of narrow that learning community down to a professional learning bubble where there's a small set of people where you meet virtually and you start connecting in almost a clinical way, which Ken probably can relate to, Nellie can relate to, I guess Alicia as well. I mean, that you start in small clinical fashion, bringing people together virtually and then face to face. It's just like good instruction in a classroom. When you've got 25 kids and you're teaching one lesson, you know that's not the greatest method. So with our staff, let's do the same thing. Break it down to the small groups and then circle back individually to those who are really having a tough time healing right now.
Nellie, what are some effective you've utilized to start the process of meeting student and staff trauma head on while still engaged in remote instruction?
So to Dr. Mike's point, in terms of using virtual platform, I think when we first started, we were just really thrown into using virtual platform to address trauma, address stressors. We now embraced it. We were forced to embrace it, but it's lend itself to open up opportunities to really listen to what we, to our staff and students. And what I mean by that is using small classrooms. Well, I'm calling them classrooms, but small virtual classrooms where teachers can really connect with their students, setting aside time and space for them and to ask the students, how are they feeling? What are they experiencing? Are effective ways that we found that we're really able to connect. This whole process and preparing for opening up the new year is really about, to us, it's really about connections and relationships. So we have to capitalize on that and kind of put in, sometimes, some people get upset that academics has to go to the side when we come back, and we have to deal with the emotional components, the emotional development of our students, but of our families. So we've gone out to do wellness checks if students aren't engaged, if parents are in need. We've gone out to the home to get them connected to resources. We are in education. We really, really have to capitalize on making connections with outside resources, community agencies, and utilizing all of those resources. We can't do it alone, and we really have to capitalize on all of the resources that we have. The other piece too is just starting off meetings with our admin team, checking in with them, sending out resources to them as well. The administrative team, I worry too about them coming back. They are in charge, right, of the students and the families in those buildings. They're responsible. So we have to make sure that we're taking care of them and setting aside time for them, time for healing, and time for connecting with them as well.
I just wanted to add a couple of things because we work with school districts and state agencies across the nation. And since March, we've hosted about 150 webinars. They're all free, they're all live, so people are just joining. One of the common themes and threads is that they are hurting right now. And the thought of trying to think about all of the unknowns when they go back to school is very stressful. I mean, they just don't even, there's just no answers. Nobody really knows. There's a lot of confusion. And I think just given the list of the 200 questions, I think that Dr. Adolescent sent out, and this list is growing and growing. What's happening right now is I just want to back up for a second. It all sounds great in the small PLCs and things when you have high functioning systems. So we're making an assumption that every school district has high functioning systems, as you've all shared. But I do want to put something out there that not every school district has a high functioning system. They don't all feel safe. The adults that work in those systems don't feel safe. They're in trauma. They've been alone. Some of them are raising their families. There's all these other sort of, factors that come into play. I would really push very strongly for every school district to push, not as an aside, but take care of your adults first before you even start to plan, scenarios or any of those things. I think that work has to start right now, not in August. People are suffering right now. We have folks that join our webinars. We're so grateful that they come, but we have people that have come to 50 or 60 webinars. They're just joining us every day because we're live, because either they live alone or we're providing some space. They're not long, they're 30 minutes or an hour, but that is just for me an indicator that people are hurting and they're in pain now, and they might not get some of those resources. So that healing work takes a long time, and it's not something you can fix in 30 minutes or a safe room in the building. It just takes a really long time. And I think that active listening that you all talked about and just sort of being in those small spaces, that is built on a ton of trust that you had before COVID and before, the murders and all those. When you have those strong relationships, when we think of SEL, just remember to just keep it in the context of what's happening in the world. what I would hate to see is that SEL sort of used as, it's going to fix everything. We all know that it is actually a framework, right? It's a framework for building relationships. It's a framework for having dialogues. It's a framework for having really hard conversations. And one thing that we have been told in the feedback that we've received is that please don't ask me to check in if everyone's going to share how great their day was. Right? It makes me feel bad when I'm listening to, like, you did 20 things and I just barely brushed my teeth. Like, those are the kinds of things that are coming up in these conversations. We were joking around earlier, like, thanks for, I'm wearing a dress. I haven't worn a dress in, 3 months. I put on a necklace. But just those kinds of things. I just hope that's top of mind for folks, because I do think it's hard. People are scared. And you're right, Nellie. I think the administrators, you're all carrying this weight of the return. And oftentimes the people who care for others forget to care for themselves. And they're the ones that end up getting, high blood pressure. They're in the hospital. I know a superintendent who is just shut down, like couldn't do anything because they were just so 24/7 for almost 7 weeks, and told his team, I can't come. But I just need to just shut down for a while. So all that is very real. And I think the stress and the mental stress, the allostatic load that one carries into the body, and Alicia knows this better than me, but that impacts your overall well-being, all your physical ailments, because everything's connected. So I'll stop there. Sorry, I'm just like voice of doom and gloom. I just wanted to make sure you all put that in there.
Alicia, I'm going to direct this as a participant question to you. We're going to shift back to students a little bit here. How can districts support students' social, emotional development during school-related closings?
I said early on, and this is not, no one had a roadmap for this, but when we think about the transition from, that day in March where one day we were in school and then the next day we weren't, we needed to quickly act in like an emergency situation. But I think where we fell short is where we went right to content. And just as we would create our classrooms and build community in our classrooms, digitally, it's just as important. Thinking about digital citizenship, how do we act with each other? How do we treat each other? Just creating those safe containers. I talk about containers a lot, and those containers mean our physical containers. What are we showing up with? What is the energy that the adult is bringing into the space? We're all carrying a lot, but the work and the onus is on us as adults to clear our spaces so that we can create safety for youth and for children. So doing our own personal work, and then really taking the time to build the relationships digitally, taking those moments to have those activities where kids are bonding, and they're learning about each other. That's vital to them being able to take in the academics. So we moved quickly to the academics and to the content for this fear of we have to get to the learning. It'll be lost, and I'm going to probably speak to that later. But being really intentional about talking about how do we engage with each other here and creating the safe spaces, creating norms for being digital. What feels safe when we talk digitally? What are things we don't want to be a part of these conversations? And being as creative as we can to make that happen in the digital space. I've seen some great examples of that, to be honest. I mean, I've seen some great examples of teachers doing check-ins, and really like talking about the specifics of how do you feel today? What's going on today for you? That has to be a part of the conversation digitally.
I want to just add to that too, because Chi made me really think about that check-in process, right? Like, don't tell me you're having a great day when everybody else is like, or don't tell me like my day's tough. I do these leadership huddles, and hold on, I think my mic is, can you hear me better now? Yeah, good.
Yes.
I do these leadership huddles, and we meet weekly, and we do these check-ins, and everything from putting an emoji really quickly in there. When you have 60 people, you can scan it quickly. And if you see a happy face, the meeting's going to go pretty well, But then again, are they just copying what somebody else did? But I know a day when I see a chocolate ice cream emoji, we're in trouble, right? Like, that's not a good day for everybody too. But I think the check-ins, maybe we can personalize that process, a little better, where it's more personal, where you don't have to highlight, that, hey, somebody's having a tough day today with that check-in, but you can acknowledge it in your head and go back as a leader and try to connect with that person. I think this circle back concept is really important, because if we keep doing things in big groups, we're going to miss a lot of people along the way.
And I think that individuality, if I may, is so important, because someone actually said to me, we're all in the same boat, and how quickly someone else responded saying, that's not true. We're in the same storm. The boats are different. They're different sizes. Some people have yachts. Others are in a rowboat with 12 people or more, trying to move their boat forward without oars. So even the checking in, Nellie, I love what you said about the check-ins and actually reaching out to the families. And what the other folks had said too is that we have to keep this individualized. Not everyone's experiencing the same thing. We don't even have equity in terms of if every child has access to electronics for the checking in. So whether it's on this or even on a cell phone or a landline that I still have, it's really important that we, I'm dating myself, but it's just so important that we don't just with a broad brush and we keep it all individualized. And I just love hearing what you're all saying. Thank you.
And if I could follow up with you, I loved your essay. I thought it was so eloquent.
Thank you.
Categorized 4 specific areas: listen, observe, assess, and engage. If you can, if you don't mind, touch on each of those components.
Absolutely. And I think this, and thank you very much for the compliment. I actually am learning so much from others and just grabbing a pen or a computer and typing it. But in terms of listening, I think that's the great place that we start, because we really need to actively listen to not just the children, but the teachers, everyone around us. And then the observing or observations are so important, because you know your children, you know the students, you know your family members. And if you see things change, being aware of it and it's okay to feel a certain way. And then the assessment process or assessing, I actually work for the New Jersey Children's System of Care, and I use this communication tool known as the Child Adolescent Needs and Strengths. It's an open domain free tool that talks to children and families and asks them questions, and that's how we gather information. So the assessment in terms of how are you doing today is it's kind of a blanket statement. What are some of the things that you're challenged with? So what are some of the things that you're dealing with right now? What are some of the things that you've accomplished, even if it's one thing? And then the actual engagement, that part of it's so important. That's why I'm just so proud to be a part of this group, because it's more than just the mental health people. It's more than just the educators. It's groups coming together so that we have equity for folks. Absolutely certain that everyone is at this table talking about how can we make this better. And the tragedies that occurred and have occurred for many, many decades, and even dating back to our founding, we really need to be open and honest with all this for it to move forward. So that's how I see it with this. And they're all kind of not one and done. This needs to be a multi-pronged approach.
I wanted to just add one piece that I feel like we are not talking about. Kids just are very honest. I almost felt before you start planning for your return, just survey the kids. They are so blunt, and they are beautifully blunt, right? They will just tell you, this isn't working for me. I don't like this. This teacher is just not there. And I know because I have a middle schooler and 2 high schoolers, so they don't hold back. But I think one of the things that would be really, we had a student panel, and we had 2 students from the New U group from West Windsor. They were just fantastic. And we had 3 students from San Diego, 4 freshmen and a junior. And when we asked them, what advice would you give to your teachers in this time period? They all said, the world is really uncertain. You just really need to take care of yourself. Because when you are calm, we're calmer. I mean, they just know what to say. They know what they're thinking. And the other piece that they loved is that when teachers gave them choice, they were all 5 of them were so clear, like project-based learning, give us a little bit more choice and voice, let us help fix problems in the world. I feel like if we can all just ask the kids prior to us planning out a real, there's mental health surveys and things like that for SEL. But I do feel like there's got to be some way in which they can share what they believe is going to be a better option for coming back. They're just as scared, just as nervous, and just as confused. And I think if they feel like they're a part of the conversation, just like as families too, it does really help. And then you can kind of get a better sense. I think you can do the listening, observing, assessing, and going into the engagement piece. But I would hate for the kids to be the last people we ask. Right? Oftentimes it would be so much better, I think, if we asked them first and then kind of went in the opposite direction. If we're going to change and make this the new normal, then let's talk to the kids first right away.
Can I just add? Greg, can I just add to that when you talk about choice and also about equity, I think it's important when we check in and when we're listening that we're providing opportunities for all students to share. So whether if they are not able to eloquently or communicate, or they're young, there's a speech delay. I think of our special ed population being able to draw it out, or or even do a charade, like making it playful, for them to be able to feel comfortable in sharing their emotions, because some of them still have difficulty sharing that. And the other piece too is that for our ELs, our special populations, making sure that they can articulate in Spanish or in Russian. And then if you're using your Google Translator, hey, we're all pros on technology right now. So if we need to go that route in order for them to feel comfortable, because when we talk about emotions, we also have to talk about being culturally responsive. And that's kind of intertwined in SEL and a lot of the equity work that we're doing. But it is super important to make sure that we know our students and where they're coming from. Some of our groups, we don't like to talk about emotions. We don't like for people to pry. So being respectful, but at the same time addressing what the need is of that particular student or even the family.
Throw this question out to any member of the panel. I'm genuinely curious, what unique challenges do educators at the elementary school, the middle school, and the high school level face regarding SEL?
I'll start, and I know everybody wants to talk about this, especially Chi. If you have middle school and high school kids, you get this. So as honest as middle schoolers and high schoolers can be, when they're in a group, the dynamics change a little bit sometimes because they are more concerned about their peers. So you get children under 5th grade, I don't know what happens at that wall, but they kind of are a bit more free and truly very honest. But when you get to that middle grades, that peer pressure sometimes, or that peer stigma, can reduce their voice. And I think that the work that we do early on with younger children and teaching them how valuable their voice is, I mean, that's the way you combat that peer pressure, by building their self-esteem when they're young, telling them how valuable their voice is and how valuable they are and other people are. Then maybe the pressure isn't so intense, but I do think we've got to be considerate of that. When we're bringing children together in small focus groups or semi-structured interviews with more than one child, we're going to have that effect. We're going to have that effect of that peer pressure that we just have to be mindful of.
Yeah, I would add to that piece that it's, the kids that we had on the panel, what they shared was, I actually have better relationships that I'm online because I've been forced to work with kids I would never have hung out with in the classroom setting. So there's these little gems and gifts that kids are getting right now that they wouldn't have normally had. This sort of, once you get into the middle school, high school space, it's the cliques and the clubs and all that. But for some reason, I think it's just because you're kind of forced in these little Zoom rooms and things that they've been able to get closer connections. I will say with SEL, so I want to just go back for a second. We just have to be really clear what we're actually talking about when we talk about SEL. It's a set of competencies. Many people will actually say, oh, we do SEL. We bought this kit, we checked off the box, and we spent, $40,000. And you go visit a classroom, they're still sitting in the box and no one's even opened it. So there's that version of SEL. It's all evidence-based, but I haven't opened the box. And then the version of SEL I think that we are all talking about, at least I hope, I'm going to make that assumption in this group, is that we're actually talking about a set of competencies that really allows one to be self-aware. Like, right, I just need to know how I'm feeling in the moment. What am I really going to get agitated with? Just that self-awareness part first, being able to have some sort of agency for myself. And then really being able to use that, knowing how I am, knowing my role, knowing when I get fired up, when I don't, and then being able to have a conversation and dialogue for better relationship skills. Can I make really good decisions? It's that framing and context I think is so important of when we do talk about SEL. It seems to be this phrase that's going across the country, but I will tell you there's a whole group of people that believe, and it's written right now, that SEL actually is a pretty racist, it can have a racist connotation and it could be used for, policing. There's this article that's out in Medium right now, and that's something we don't want to do, right? It can't be a structural tool where we're creating rules and regulations, right? Self-awareness does not mean keep your hands to yourself because we don't hit in the school. But that's how people, I mean, some schools are doing that. They're using that model of SEL and they're putting those pieces in place. And so I think one of the things that we just need to be really careful about is the structures and the framing of SEL. It's used as a guide and as a tool, but it should not be used to sort of guide discipline practices or, the things that really can be much more punitive. It's not to control children. It's really, we start with self first and then how we engage in conversations. And I think that starts from really young itty bitties all the way through high school. So.
I think that's a really important piece because when you look at really doing foundational SEL and you connect it to, if we don't do something so valuable, such as connecting and reconnecting the children, you look at the ACEs study, the Adverse Childhood Experiences, and really one of the most important things that we could do in reconnecting or connecting and teaching individuals how to connect with others. Left untreated, this pandemic or this worldwide trauma is going to be really something very powerful. So that's very important. You just can't put a label and say SEL. You really have to be foundational. Thank you for that.
Going to shift gears here with a question from one of our participants. I'm going to direct to Nellie. With the inevitable push to reverse an expected academic slide, how can educators best advocate for much needed social and emotional learning in schools?
Nellie, you're on mute.
Yes, now I'm not. So I love the question, and it's really advocacy and really just prioritizing it. I don't see how you can say SEL is a focus if you don't make it if you're not making it a focus. It has to be built into to classrooms, every classroom, particularly with, I think you mentioned middle school, high school, right, Greg? Yeah. So
Yes.
There's such a heavy focus on academics. We need to take a step back and look at how can we integrate those SEL core competencies into content area. There's a lot of research. There's a lot of work that's done where it's being done. I think we need to capitalize on those resources and train staff because that's definitely I see it as a mind shift. We're trying to prepare for high school, then for college. We have to take a step back and focus on where our students are. To me, it's plain and simple. I don't have anything boxed up. I just really think that it just has to be a priority. And I think that starts with leadership. When staff see leadership making it a priority, you're modeling that, your staff follow and your kids follow. That's been my experience, as an administrator, but I've seen it, work in all of our schools across the county and New Jersey. So it has to be a focus. It just has to be, and not make an excuse. And it's not a task because you have to remember when you're doing the work for sustainability. It's not just because of the pandemic and COVID-19 and the violence that we see right now going on. It has to be a focus for consistency and moving forward for years to come. That's why I firmly believe that's why we're experiencing a lot of things now that have been going on for 30 or plus years. So it just has to happen. I don't really have a direct answer other than saying you got to do it. You got to do the work. It's heavy lifting, but it has to be done, and we have to advocate for that.
I do want to add that the neuroscience is really clear that if you are not socially, emotionally connected to the adult who's trying to teach you content, you're not going to learn anyways. The cognitive structure, right? Your head and heart are connected deeply. And forget academic content for a second. If we just think as adults, if I'm angry with someone, the last thing I want to do is listen to them. If I don't actually get along with the person, like every time you walk into the room and I get like this sense of agitation, I'm not going to feel safe. It's the same thing with kids, that feeling that Nellie talked about, right? That it's hard work, but just notice what they're going through. But it's all the neuroscience is really clear that it's all connected. Social emotional learning is not separate from academics. It's actually all a part of it. And I think that part of the neuroscience, I think for teachers who don't buy into SEL, that is the body of research on that is very, very clear.
Yeah, I'm glad that she jumped in before me, because this is really perfect for me to entertain this concept with this group and for the folks that are watching, right? So we're talking about academic slide, and I want us to consider some competing maybe ideas or perspectives here on this. Yes, there are absolutely kids who are regressing, and there are academics that are lost. But, you know, for a really long time, we have drank the Kool-Aid thinking that, you know, high stakes testing was it and a hard focus on academics was it. But let's not forget that learning is happening. We have children that are leading protests in streets right now. There is learning happening right now. And SEL is about lifting up and celebrating culture. So if we miss the boat here, who said it can, right? Kids, they can tell, they'll see right through us. And it's our responsibility to make sure that we create a bridge from that learning that's happened in real life right now, watching men die, Black men die on TV, and the action that kids have kicked in to protest this and to stand for something. We have to translate that into academics, because that's learning. And that's what we haven't maybe necessarily equipped our children with. But if we don't now lift up that that's happening and that they're learning from this and miss the boat, they're going to see right through us. And for our children who have the most fragmented relationship with school, are chronically tardy and are chronically absent, they may not return, knowing that schools aren't going to take this on head on. We have to. It's our responsibility.
Can I just add, Alicia, I'm just so thank you for that, because I do hope that teachers don't go back in and say, go open to page 12. We're all good. Like that is just not going to be, it's not possible. But I think just the way that kids right now, one of the things on the panel that they said, because of the project-based, they were actually given choices of what kinds of problems in society to solve. And that was something they really felt that they had agency over, right? They're taking their anger, creating agency, and then taking action. And if we can just kind of get that through line all the way across for at least, you know, 5th grade on up, right? I feel like that is something that we can really promote and take in. But again, just to go back to, that can only happen if the adults feel safe, that their administration is not going to go off on them because their test scores went down. Like, that is just something that leaders have to take to heart. So thank you for that. That was awesome.
Yeah, and in addition, thinking about, I lost my thought. I'm gonna just stop for a second because it absolutely just left my mind. But
well, let me jump in, and you can
jump in, Mike.
because you and Cheek, we're gonna put you in a separate room, because you guys can go back and forth all day, and it's awesome. We love it. We love it. I was gonna mute my whole screen because it was so good. So I want to just touch upon, we keep talking about the competencies of SEL, and the, you know, the idea of forming sustainable relationships keeps coming up, whether it's your relationship with school, right? And I know you as a SAC, right? You've seen the struggle, especially with substance use disorder, where people just have this struggle with connecting with their family, connecting with their loved ones. And then they get into the workplace as adults and have trouble connecting at work with people. And if anything we learn from SEL is that these competencies help to prepare us not just to make those good decisions, but to form long-lasting, sustainable relationships. You have far too many people isolating themselves from their family, whether it be political views, whether it's like, hey, you're not my friend anymore because of a meme you put up or something. We've got to teach children at a very young age, and we've got to model it at adults that relationships are important. And to have a sustainable relationship, there has to be this mutual understanding and respect. And that ties into every competency that we're talking about today, and so much more of the work that's important. I just can't wait for the day, though, that like Alicia is running a school district and she's like, all right, so the final exam is you have to be able to build a sustainable relationship with somebody, or you have to be able to demonstrate that you have some self-awareness. Like that would be, I mean, that's the icing on the cake, right? It's the greatest day ever for schools to kind of value those skills and stop calling them soft skills, you know? So just value those skills instead of numeracy and literacy. Not saying they're not important, but maybe I would think they're a second and third to it.
So Mike, you helped me remember what I was going to say, which is, you know, and the relationships we know are one of the single most reparative and protective factor against the trauma and against the damage that that happens when kids experience trauma, which, you know, we could say that all kids are experiencing some level of that right now. But in addition to that, really having meaning, like what opportunities are we giving kids to be contributions? Like, where are we lifting up that student voice and that student agency and saying, you know, you have something to offer here. Like, do we actually listen to kids' contributions? We go back to that concept of deep listening. Are we actually doing that? Because that's a part of resiliency as well. So when we're creating conditions for children to have meaning and offer a contribution like they are now with their voice or however they're demonstrating their frustration and anger with what's happening in the world, that helps build resiliency against the exact thing that we're talking about. That is another pandemic. Our children's mental health is a pandemic.
I want to give you an example, a real life example of student voice and agency. So we work with the Rhode Island Department of Ed, and the commissioner there, Angelica Fonte Green, and the superintendent for Providence. They've been having these student forums, right? So on the weekends, they have students come in, and a group of students actually planned the protest this past week. So what does the Rhode Island Department of Ed do? They actually print out and put on all their social media accounts what you need to take when you go to a protest. Here are the rights that you actually have. And these are the things that you need to know. For me, I've never seen that ever coming from a school agency in any state. And Rhode Island took the opportunity to lift up their kids' voices and actually gave them agency, and then gave them, like, here are your rights. Like, this is what's going to happen. if it happens, here's what you can do. And here's what you need to know. Like, to me, that is a perfect example of listening to kids, listening to their, you know, taking their anger, right, agency and then action, and then actually giving them some tools to make sure they stay safe. To me, that is the perfect example of how we do uplift voices in ways that matter, and it's super meaningful. And I just feel like that's, you know, if we can offer those opportunities for kids, don't tell them, you know, you can't go. Okay, if you are going to go, let's figure out how to do this so that you stay safe.
And that's the engagement part of that article. You have to get everyone to the table, but you're just highlighting that the children are the most important.
Wonderful natural ebb and flow here, and I apologize for interrupting that. I want to shift gears with a question from one of our participants. I'm going to direct to Mike. It's a tough one, Mike. How can clinical screening tools be used to set a foundation for broad school-wide interventions? So in other words, what data will be used to address wellness with social and emotional learning?
I feel like this is one of those dating shows where someone's behind the screen and they're like, and this one's for Mike. And I have to figure out, well, are they tall? Are they not? So this is a fun format. Thank you, Greg, for making it so interesting. So what data is going to be important to us? Well, I think we've all touched upon this topic a little bit. You know, what data are we collecting? What's important? And I think it's got to be that qualitative piece, things that we can observe and record. I mean, the numerical data, I mean, every superintendent on right now is so sick of surveys, right? They're like, oh, another survey. I know. But at the same time, those surveys can be really meaningful for us. And if we use it for our staff and our team, and small focus groups, I think are really important to getting people together so that they're comfortable enough with their peers in a small group to share what are their concerns. I know if I get a small group of people and say, what are your concerns? People say, well, do I have to wear a mask? You know, I can't even wear a mask to the store for an hour without feeling claustrophobic. Or what about the kids? If I'm in preschool, do I have to wipe their nose? Do I still change them? What if they have a fever? Like, we can go on. Dave Adderall has all the questions, you know? So, but these are the questions we have to give people the opportunity to sit down and talk and then collect that data to make some real informed decisions. It doesn't have to be about the numbers. It just has to be about the people. And that's really important here.
I'll throw this question out to the panel, but Ken may want to answer it. How can families with social and emotional learning needs be supported at home, and with what mental health resources?
In New Jersey, we're really fortunate. We have a statewide children's system of care. So I just really wanted to point out that it's open to all children and families, ages 5 up to age 18. We can remain with them up to age 21 to transition if they need longer term involvement with a developmental disabilities division. And these services are open to any child. So New Jersey's been a pioneer in that these services are paid through Medicaid dollars. And there's 5 different types of Medicaid. The 4 types are based upon finances, but the 5th that's been captured is open to any child and family, regardless of their ability to pay. If they don't have the paperwork, whatever that means, and the services are brought in their home, in their communities, hopefully by those individuals. So that's a great resource to have. Some of the resources from our conversation here got me thinking that have food on the table, the ability to keep a roof over their head. There's a great resource called njresourcenet.org. It's county specific, a lot of faith-based organizations. So there's a lot that we can do for the larger family system. And this is a systemic challenge ahead of all of us. And if we roll our sleeves up and share what we have that's already been established, I think the outcome is going to be pretty positive. And if the children write it up, it'll be very honest and blunt and direct.
Another question for the panel: how can social and emotional learning practices be integrated with reluctant staff? Anyone?
Carefully.
So again, I feel like it's the framing of what SEL is, right? It's having a common language, I think, is really sort of paramount. It's the structure, the framing, reluctant in what way, and how is it being introduced? Like I would think of all of, what makes them reluctant. It may be that if we're asking them to share everyone's feelings, like, hey, that's not for everyone. Not everyone doesn't want to share their feelings. And it may be where someone's never been asked and they don't want to. There's a comfort level there. I think that's super important to gauge where your staff's at in terms of what you're actually asking them to do. SEL doesn't mean go in a room and everyone sit down, close your eyes and start, sharing your deepest, darkest secrets. That would scare a lot of people away, right? And especially in this pandemic piece. But if we go and approach it in a way that we're going to actually have a common framework, that we're going to use structures so that we can actually build on, the self-awareness piece. The reluctancy would be, for me as an adult, just knowing as a teacher or principal and superintendent, if my boss told me that I had to use a new program when I'm coming back from a pandemic and from all of these other issues and where people are talking about being anti-racist educators, I don't want a boxed program. That is just not going to do anything for me, and I would be very reluctant. But if they gave me a set of questions that I could ask for the first week of school to all the kids that are going to come into my classroom, but I get that modeled first, hey, what's the scariest thing that's happened to you during this pandemic? What do you worry about the most when you're back in the classroom? What's the best thing that happened to you? Really couch it in sort of the positives, like sort of the roses and thorns, I think is what people usually use. But in ways that you can just develop a real just common language. It's almost like breaking bread. Like, how do you even start a conversation at a dinner table? It's those kinds of things. That's all social emotional learning. That's all SEL practices. And I think if we stop thinking of SEL as this thing that we're doing to people, which is the worst thing we could do, and start thinking of SEL as a way in which we communicate, if we frame it that way, I think there'd be less reluctance, and the buy-in, I believe, is just really challenging. It's all in the framing, and it's all in the introduction. And again, if teachers feel like you're going to give them another thing to add, teach this at 2 o'clock every Friday, and that'll fix all your problems, I feel like that is going to ruin the entire initiative. And it really is just a communication tool to make us better and thoughtful partners.
I agree. And I love that you said that, it's not going to be basically enforced for those reluctant staff. You want to find out the why. You need to find out why are they reluctant, and sometimes be patient with that staff member. I think sometimes we lose patience because we want them to understand, but we really have to take the time and guide them to have a deeper understanding on the purpose as to why we're doing the work, and find their strengths. If they're with us, we hired them for a reason, right? So what are their strengths? And how can we utilize their strengths to be part of this process with our students?
What if this was just who we be? And I know that's not grammatically correct, but I say that intentionally because it's very different than who we are, right? Like if who we be is our very next action is coming from compassion, our very next action is coming from a heart-centered place, our very next action is coming from understanding. It is just who we are. It is just who we be in our schools and our settings. So there's nothing to do, right? Like there's nothing to ask of them or give them. It's just how we now show up, how we do school. That's what's exciting about where we're at right now, because we get to shift into who is it that we want to be? How do we want to expand the vision of what learning is and how we receive people, like from a really heart-centered place. I think, you know, Monmouth County, I'm a little biased. We have some of the most heart-centered superintendents and school leaders. And I'm sure there's tons of those same heart-centered folks across the state. That's the energy that has to go into what we do on our return. And to just piggyback what Anelida said about the strengths, I want to entertain this idea and throw it out there. That what if we had every single student connected to their strength, their asset, whether it's music, whether it's debate, whatever it is, right? And we had every single educator assess what their strengths are. And we paired these two groups. We paired educators that are passionate about whatever it is, cooking, dance, music. And by the end of the school year, there was a contribution that each of these service projects did. And it's based on your strengths and your assets. That goes back to how we, build on the resilience component of knowing that we are meaningful and that we're purposeful. We find out, we assess, we ask the question. It goes a long way just to ask, what are you really good at? What are you really passionate about? Pair them with the adults, maybe not even just in the brick and mortar, in the community, that they can now work together collaboratively. And at the end of the year, everyone's paired and everyone's working on something that is service oriented. This is who we be.
I want to jump into this.
Excited, Mike. I'm so excited.
I know, and I know the time is running out, so I'll be mindful, Greg. But I think reluctance comes from the misinterpretation of what SEL is. So when you think it's about, oh no, they're going to make me do yoga again, right? Exclusively, right? Oh no, I'm going to have to breathe in and entertain this ridiculous guy while he's breathing in for 5 seconds, breathing out. If they think it's exclusively that, then you're going to have reluctant people. But I think the relevancy in all of SEL is that if you just said to somebody, SEL is about learning why you see the world the way you do. And then also learning how other people see the world the way they do. If we frame it that way, considering the context of the backdrop of what's occurring right now, hey, don't you want to know why you see the world the way you do? That's SEL. It's not your breathing techniques. It's not your yoga. It's getting to know who you are and why you see the world that way. And I think that's, if you frame it that way and people are still reluctant, they probably shouldn't be in education.
It's absolutely tremendous. Ken, sorry to interrupt you. You go.
I was going to say, I've been listening to music during my downtime. So when I mentioned cooking, I'd probably burn something. But I just think of the song. I just heard 3 songs before. It was Imagine by John Lennon. And then I also wrote a piece, again, about music in terms of We Are the World. And it's a group of people coming together to feed, to give people the basic needs. In terms of social connections is just as important as food and as air that we breathe. So I just want the energy that you're all given is something I hope is just contagious. All the attendees take this and run. And it's who can we be? I forgot, Alicia, how did you say that? It's who you be? Who I be, right? Is that, I love it.
Yeah,
That's my mantra. I'm gonna you be. I got to find out who I be.
I'm going to ask each of the panelists if they don't mind for a closing thought. We'll go around the table and we'll start with Chi.
My closing thought would be, I just want everyone to just take a minute or two to think about how hard it's been for you in this whole piece, right? This being at home and watching the pandemic, grieving, watching, loss of life, grieving more, and really being able to imagine how hard it's been just for you individually. And then just take that feeling that you have and think about how hard it is for all the folks that are going to join us back in the place. I think one thing that we can stop doing is make assumptions about teachers and educators and how much they don't want to do. I don't think that's ever true. The system has structured it so they don't want to do these things because we do unto teachers all the time. We do unto kids all the time. And so my real hope is that we make a great assumption that we're all in this. everyone wants to come back and do the best that they can, but they're just afraid. And if we set up structures where we can, you know, take everyone who they are and who they want to become and be, Alicia, I feel like that it's really important just to remember that. We always think in systems as leaders in education, and we're instead of thinking of people. And I think if we go back to just thinking about the human beings that are coming back, the strengths, the tragedy, the grief that they've all suffered from, every single one of us has suffered some kind of grief. Everyone's coming into that table with that same piece. And I just hope we come back a little bit less judgmental and a lot more open about what we all can do together.
Nellie?
You put me after Chi. Just final thoughts. I think being patient, being kind, being empathetic to those around us, to those who we serve, is gonna, in the end, you know, we'll be stronger together. And don't be, you know, be mindful and look for resource. Look to your neighbor who can help you when you're in times of trouble. If you're struggling, we need to take care of ourselves, like she said, and you have to. If we're in this position and we're in the field, we have to take care of ourselves, each other, and some of us are families. You know, we have suffered a lot, and don't ever assume that we may know someone else's experience. Everyone has experienced loss a different way. Loss has taken on another terminology here. So we don't make assumptions, and just be patient with each other. Thank you.
Thank you. Alicia?
So I would like to leave you with one of my favorite quotes, and that's by Viktor Frankl, a great existentialist. Viktor Frankl says, between stimulus and response, there is a space. And in that space is our power to choose our response. In our response lies our growth and our freedom. To me, that is the essence of where we are. There's tremendous stimulus, and we can't take the risk of just reacting. The response is so important, and the opportunity here is to just pause. And in that pause, I invite people to just imagine what we can create from this space. I'm so grateful to have been a part of this. Thank you so much.
Thank you. Ken?
Yeah, tough to follow as well, but I've learned from everyone, and I think mine's going to be a question. Systems have hurt. Systems can heal. The question becomes, can systems listen and hear? That's all. Thank you. I've learned so much from all you. Thank you.
Thank you. And Mike?
So I think, wow, so many great insights from tonight. We've got to connect offline. These such a great group. Just if at the end of the day, we can take our children, right, and our adults and teach them to not only value and respect their own life, but equally value somebody else's life who may come from a completely different walk of life, then I think we've done our job. Regardless of any other metric we have, that if we can teach them that valuing their own self is so important, but equally valuing somebody across the table, across the aisle, across the street, I think we've done it. And I'll close with, I'll take contestant number 4. Oh.
It's like Mike. Our panelists were outstanding. Again, challenging and difficult subject material, and you brought the energy tonight, so we can't thank you enough. We hope that everyone joins us next week on Thursday, June 18th at 8 p.m. Eastern Time. Our topic will be medical guidance for school reopening. A panel of nurses, medical professionals who have been on the front line of COVID-19 will share insights on best practices for mitigating health risks as we work to safely reopen our schools. Once again, thank you everyone for joining us. Please consider following the RestartED team on Twitter at RestartED team. And we'll see everyone next week. Until then, please be safe and be well.
Thank you.
Thank you, everybody. That was fun.